Welcome to Not Milk Never Milk. Subscribe if you're lactose intolerant.
You start by cleaning the damaged area with 70% isopropyl to remove grease and dust so resin bonds properly. Once done, dry the spot and mask the surrounding glass to protect trim. Insert the injector or applicator firmly over the chip or crack. You want a sealed contact to push resin into voids. Apply gentle pressure to establish suction or vacuum, then prepare to inject resin. This step controls penetration and prevents air entrapment. You inject resin slowly, watching as it fills the fracture lines. Patience matters because rushing traps air. Once the cavity is filled, apply pressure or vacuum cycles if the kit requires them. This forces resin deeper and removes microbubbles. After the resin appears level with the glass, wipe excess and position the curing strip. Expose the area to UV light for the full recommended time. Proper cure ensures the resin hardens with clarity, and you remove the curing strip and use the supplied blade at a low angle to scrape away excess resin until the surface is flush. Then polish the repaired spot to restore clarity and blend refraction. This step makes the repair less visible. Inspect for tiny air pockets. If you see any, do not panic. Reapply a small amount of resin to the pocket, repeat the injection and curing cycle, and make sure you used a sealed injector to prevent recurrence.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.